Did you know that men are 33% less likely to go to the doctor than women? 65% of men say they avoid going to the doctor as long as possible, and 20% admit that they aren't always honest with their doctor about their health. This is why Men's Health Month, which is recognized in June, is so important. I'm Alexis Burrows, Marketing Director of Doctors Hospital. Today, men, we're addressing your health issues, and women, the importance of getting men to seek medical help. So keep watching. This is You and Your Money.
You and Your Money is brought to you by Doctors Hospital Health System.
Welcome to You and Your Money, everyone. Again, I'm Alexis Burrows, and I'm today's guest host. Here with me to talk about men's health is urologist and laparoscopic surgeon, Dr. Gregory Pinto. Welcome to the show, Dr. Pinto.
It's definitely my pleasure to be here, Mr. Burrows.
Now, earlier I shared some statistics from both the CDC and a recent survey conducted by Cleveland Clinic, which reported that 65% of men avoid going to the doctor as long as possible. Some of the reasons included fear and embarrassment. So I want to start our conversation covering a topic that a lot of men are too embarrassed to talk about, which is erectile dysfunction. It's reported that 1 in 10 adult males suffer from the inability to achieve and sustain an erection for sexual intercourse. So at what point does failure to get an erection become a problem, and how often is too often?
The simple answer is that for any man, even one time is too many. But you have to understand that at one point in every man's life, they're going to have some amount of erectile dysfunction, particularly as you get older. In fact, in the last 20 years, there's been an onslaught of younger men who have had, for many reasons, including the readily accessible use of pornography, have had pornography-induced erectile dysfunction. But even one episode of erectile dysfunction puts a pressure on the man that he doesn't want to fail his partner, he doesn't want to fail himself. Many times when you have one incidence of erectile dysfunction, the female partner will start having either vocalize or even subconsciously feel that maybe their male partner is not attracted to them, maybe there's a sweetheart, maybe there's some discord in the marital between the marital bed itself. But that in itself can be self-defeating. So the man is going to be preoccupied with not having that occur again, and that in itself can cause erectile dysfunction to become a vicious cycle. But if you have more than one episode and you're concerned, it's always best to seek medical consult. Let's find out what the root cause is. It's always important to find what the root cause is, not just to treat the symptom, and then we can come to a solution.
So, you mentioned some of the reasons earlier as to why men may have erectile dysfunction, but can you speak to, I guess, a broader list of what some of the reasons may be for a man developing the issue?
So erectile dysfunction is a very complex issue. It has, it's multifactorial. There are many factors at play. Simplifying what an erection is, how do you get an erection? First of all, you have to look at the emotional, psychological, mental component. That's extremely important. I think not a lot is said about that, but that can be a very prominent cause of erectile dysfunction. Then we talk about the hormonal component. We're talking about the male hormone testosterone. You need to have a normal testosterone level or normal testosterone level to get an erection, to sustain an erection. Then we talk about the blood supply to the male member and the nerve supply to the male member. Erectile dysfunction, in fact, might be a precursor, might be an early warning sign of something more sinister going on, such as heart disease, early heart disease, or atherosclerosis, or it might be because you have a new onset of diabetes or uncontrolled diabetes or hypertension or hypercholesterolemia. So essentially, if you have erectile dysfunction, it may be some early warning sign that we need to solve that problem before something more sinister goes on in later years.
Yeah. I know we've had that conversation before on the Doctors Hospital podcast about how it works as a marker for other issues that may be going on in the body. So how exactly would you go about diagnosing erectile dysfunction? Because you mentioned that someone may have a one-off instance, they may have weeks or months or even years, but what is the process for diagnosing erectile dysfunction?
Well, first, obviously, you want to start with a thorough history, as we do when we ever see a patient. So you want to know what exactly medications that you're on, what surgeries you've had in the past, which allergies to any medications you may have, in terms of what medical illnesses. Are you taking the medications? So a lot of men in particular in this country, yes, they're being diagnosed with diabetes. Yes, they're being diagnosed with hypertension. They take the medication or they never take the medication, but they're not compliant. And that in itself can clue us into what potentially could be the problem. So obviously we're going to do a thorough history, we're going to do a thorough examination, we're going to do vitals, we're going to do routine bloods, we're going to make sure that your testosterone level, not just your total testosterone, your free testosterone level is in the right range. Make sure that there's no other issues in terms of high cholesterol, in terms of renal dysfunction. Make sure that you're not anemic, make sure that your prostate-specific antigen is in the normal range as well. So in essence, a urologist has to be a private investigator. We need to find out what is the cause. In many cases, it's many causes that causes the erectile dysfunction. And then we need to treat the root cause.
Right.
If we just treat the symptoms, if we give you a little blue pill or something equivalent, yes, you may continue to get erections for another 2 years. But if the issue is uncontrolled diabetes, for example, if we don't treat that root cause, it's going to cause untold harm to your blood vessels, to your nerve supply, to your male member. And even the little blue pill is not going to help you in 6 months, 9 months, a year's time. It's going to affect other organs in your body as well. So we always want to treat the root cause, and in many cases, unfortunately, it's more than one cause. But the take-home message is that no matter what, and I always say this as my mantra, you can always rise again. Never give up hope. There's first line, second line, third line, fourth line treatments. No matter what, you can always rise again. Never give up hope that erectile dysfunction is something that you just need to live with.
Okay. So we can't leave this topic without addressing, obviously, the other person in the room, which would be the female partner. What kind of advice would you give to a partner who may be having, their male partner has an issue with erectile dysfunction? What kind of support should they offer?
So anytime we're dealing with erectile dysfunction, it's not just the male member. You need to have support. And obviously, if it's the female partner, the wife, they also need to be supportive because they're also going through this as well. So the goal is you want to get your erections back on track. You want to have good sustained erections. You want to make sure that you have spontaneous erections. Premature ejaculation is actually the most common form of erectile dysfunction. Not enough information is out there regarding premature ejaculation. 1 in 3 men of various ages is going to have premature ejaculation. That can be very frustrating. If you're going to orgasm within a minute, 2 minutes, that's going to be frustrating to both the male and the female. There's so many things as a urologist I can do to get you to 15 minutes, to get you to 18 minutes. So even if you're dealing with premature ejaculation, even if you're getting a good quality erection, but it's just not lasting, there are things that we can do to get you back on track. But you can't deal with this in silence. You need to have your partner support you. It has to be couples that you need to usually come in, and we need to address and get a solution to the problem.
Dr. Pinto, we have to take a quick break, but we have a lot more to talk about. You're watching You and Your Money. We'll be right back.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now. 3 advanced facilities at Collins Avenue, Carmichael Road, in Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Doctors Hospital's pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
Welcome back to You and Your Money. If you're just now tuning in, I'm Alexis Burrows, the guest host for today's show. I'm also the marketing director of Doctors Hospital. It's Men's Health Month, and we're talking about men's health with urologist and laparoscopic surgeon Dr. Gregory Pinto. Before the break, we talked about a health issue that a lot of men are too embarrassed to talk about, which is erectile dysfunction. Now, I want to talk about a health issue that society at large doesn't necessarily talk about a lot, and that's male infertility, which is where a female is unable to get pregnant due to issues with a male's reproductive system. So, my first question for you would be, how common is male infertility and what are some of the causes?
Well, we left to, first of all, define what male infertility is. As you alluded to, it's a couple having unprotected sex for at least a year. So let's say that all factors for the female and the male are perfect. You only have a 15% chance of getting pregnant every single month. So the typical couple, young couple just got married, takes at least a year before they're able to conceive a child. So if you are having issues and it hasn't been at least a year, you can even push it to a year and a half. Don't have any concerns.
Okay.
So, and when we talk about infertility, there are male factors, there are female factors. There are some instances where it's both male and female factors. So in terms of fertility, about 33 to 40% of the time, it's a male factor that's leading to infertility. And there are many reasons that you can have male infertility. So I always like to start off with, in the worst case scenario, because of advancements in reproductive medicine and technology, male factors really, in most instances, the vast majority of cases, is not a real issue. Even if you have, the typical ejaculate has 250 to 300 million sperm. If you have as many as 40 million sperm, you should be able to conceive naturally. But let's say you have 20 sperm, 25 sperm versus 400 million. You can still conceive because of the advancement of reproductive technology, where we can have even sperm that has no motility, that it's not able to move at all. You can do ICI, intracytoplasmic injection. So you can inject the sperm directly into the embryo, into the egg to fertilize it. You can do IVF, in vitro fertilization, that basically takes male infertility out of the equation. So for the vast majority of cases, it's really the female factors that are going to determine whether you're going to conceive or not. So even if you're frustrated, if you've been trying for years, if you have issues where you've had sperm analysis that over the years have shown repeatedly that you have many issues with many parameters because of IVF, because of intracytoplasmic injections where even if you have no motility of the sperm itself, you can still have a child. And then in fact for IVF, you have about a 40 to 50% chance of getting twins every time you have IVF. So you can get two for the price of one and get them out of the way. So never give up hope, and that's always my mantra, never give up hope. There's always something that can be done. So when we look at the causes of male infertility, there are multiple. You can have congenital issues that you're dealt with, and you can have acquired issues. So you can have genetic, chromosomal, you can have issues that are acquired, such as previous surgeries that it might have affected the nerve supply, the blood supply to your male member. It may have affected testosterone production. You may have had an undescended testicle where you didn't have surgical correction until after the age of 13. That in itself can reduce sperm production. One of the more common causes for male infertility is a varicocele. So veins take blood back to the heart, arteries take blood away from the heart. So just in the same way that you have varicose veins, where you have a distension of veins in your legs, you can have a distension of your testicular vein, where there's a sludging of the blood and there's a pooling of the blood because the valves are incompetent. So when you have veins carry blood back up to the heart, there are valves that allow it to go up against gravity. If you have an incompetence of these valves, you can have a varicocele, which is a distension of your testicular vein, similar to varicose veins. That can affect the environment of the testicles themselves, that can reduce the ability for you to have proper sperm production. So varicoceles are relatively common. Maybe 1 in 6 to 1 in 9 men are going to have varicoceles. Just because you have a varicocele doesn't necessarily mean that you're going to have an element of male infertility, but that's the first thing we're going to want to rule out. Obviously, we're going to also want to check your testosterone level. You need to have a proper testosterone level to be able to make sperm in itself. You may make sperm. It's just that because there may be actual physical obstruction that doesn't allow the sperm to come out with the ejaculate, that in itself can be an issue. So There are many reasons that you can have, whether it's a physical or functional or anatomical abnormality. It may be related to issues related to a viral illness. We just in the midst of this COVID-19 pandemic, which hopefully we're getting out of. That in itself can affect fertility. That can affect your testosterone level. That can affect the ability for the testicles to produce sperm. Other viral illnesses such as mumps can also do the same thing. So if you have just had COVID-19, you may have abnormal sperm parameters for 4 months, 6 months, 9 months, which in many cases it resolves itself. So we need to examine exactly what are the causes of male infertility, address those causes, and then in many cases we can get you to be able to conceive a child.
Now you mentioned a sperm analysis. Can you kind of just expand a little bit on how a sperm or semen analysis would help in diagnosing male infertility?
And when we look at sperm analysis, many people think it's just sperm numbers. It's a lot more complex than that. There are a lot more parameters. There's liquefaction within 1 hour to 2 hours. There's the morphology, the shape of the sperm itself. It's the motility of the sperm itself. So there's a long list of parameters that you have to look at. It's not just actual sperm numbers in itself. There are many other things. Like you can have perfect sperm numbers, but because all the sperm are abnormal in shape, or because there's no motility of the sperm themselves, that in itself can cause infertility.
So another common concern that you hear people talk about is that too much heat can lead to issues with fertility. So is there any truth to having your laptop, like for a man holding a laptop on his lap, wearing tight clothing, doing too much in terms of going to the sauna or hot tubs or things like that? Is there any truth to that having a role in male infertility?
Can increase in heat cause disruption in sperm production? Yes. Can wearing tight clothing all the time cause there to be an increase in heat production and reduce the optimum environment for sperm production in the testicles? Yes. But even though you may have a slight reduction in sperm production, is it going to cause a significant effect on your male fertility? Most scientists will say no. But the answer is, if you're concerned, yes, don't wear boxers instead of briefs. Don't go in hot saunas all the time. And for many health reasons, don't have a laptop on your lap anyway.
Okay. All right. So what are some of the treatment options and lifestyle changes that someone can undertake in order to help with infertility?
So we have to look at how do we produce sperm. We have to look at what are the issues that can affect that. You want to have generally good health. You want to have a healthy lifestyle in terms of dietary, in terms of behavioral. So you want to have behavioral body mass index you want to have in a normal range. Obesity in itself can negatively impact not only testosterone production, which can impact sperm production, which can lead to even erectile dysfunction. So you don't, if you're overweight, want to lose weight. If smoking is very hazardous to sperm production. So if you're a cigarette smoker or a cigar smoker, you should, for many health reasons, in terms of potential heart disease later on in life, production of multiple cancers, you want to stop. You shouldn't be smoking. There are many things that we need to look at. There are medications that can affect testosterone production. There are medications that can affect the delivery of sperm itself. You can have anejaculation, no sperm coming out at all. You can have retrograde ejaculation. So you're making the sperm, but it goes, every time you ejaculate, it harmlessly goes back into the bladder. And after sex, it comes out in the urine. So obviously that's going to affect fertility. So we have to look at what medication you're on. We have to look at your lifestyle. We look at your body habitus. And we need to optimize your health and make sure that we can get you optimal male fertility.
Right. That's some awesome information, Dr. Pinto. So we have to take a quick break, but when we get back, I want us to discuss an issue that's affecting over 60% of men over 50. This is You and Your Money. We'll be right back.
Doctors Hospital's Pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now. Three advanced facilities at Collins Avenue, Carmichael Road, and Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Welcome back to You and Your Money. I'm Alexis Burrows, today's guest host. Today's guest, Dr. Gregory Pinto, urologist and laparoscopic surgeon, is still here, and we're continuing our discussion on men's health. Dr. Pinto, it's reported that 60% of men between ages 51 to 60 will experience an enlarged prostate. This increases to 90% in men over the age of 80. So can you answer for us, what is the function of the prostate gland?
Well, simply, only men have prostate glands. Let's get that out of the way. The prostate gland is a walnut-sized organ that anatomically lies underneath the bladder. Its only function is in regards to fertility. So it provides an optimum environment and provides nutrients for the sperm to allow it to fertilize the egg, the embryo. So beyond that, the prostate really has no role. Because of its anatomical location, it can cause an obstruction of not just your pee pipe, your urethra, but actually the outlet of your bladder itself. So we're going to have to differentiate between prostate cancer and benign prostate hyperplasia, non-cancerous enlargement of the prostate, which is inevitable. If you're blessed with advanced age, you're going to have an enlargement of your prostate. Across all spectrums, you're going to have an enlargement of your prostate. What is the consequence of that? You're going to have urinary symptoms. You're going to have lower urinary tract symptoms. You're going to wake up in the night frequently to urinate. You're going to have a weakened stream. You may even have a stop and start stream. You have incomplete bladder emptying. You have urinary urgency, where if you have to urinate, you have to go without delay. You may have issues where you have urinary hesitancy. You're at the bowl and it takes maybe 45 seconds before you can even initiate that stream. If you're not emptying your bladder completely, you can have something called post-micturition residual leaking. So you're walking away from the toilet and then you feel that leaking into your underwear, which can be very depressing. So if something is not right, men know if you're waking up 5 times in the night to urinate, you know something's wrong. If you have to drive with a bottle in your car because you're not able to even pull over to the side of the road to pee behind a tree, there's something wrong. If your bladder is controlling your life because you have to worry about in your day-to-day activities, where's the next bathroom? If you're scared to have a glass of water, if you're scared to have a glass of wine or a beer with the friends because you know you're going to be peeing every 5 minutes, something is wrong. You're not emptying your bladder. It's not just a nuisance. If you're not emptying your bladder, you can have irreversible changes to your bladder that can be disastrous. You can have back pressure on your kidneys that can lead to acute kidney injury, and if you allow it to last for periods of time, you can have chronic renal failure. So always listen to your body. If something's not right, if something such as your bladder issues are affecting your quality of life, socially, professionally, sexually, then seek help. There's no fear in seeking help, and you're not alone. Every man is going to have some element of an enlargement of your prostate as they get older, 40 and older.
Okay. Now, you mentioned BPH, which is the non-cancerous version. So how is that diagnosed and treated?
First, we'll take a history. Obviously, we'll do a physical exam. We might want to do some imaging, if applicable or warranted, to determine whether you're in fact emptying your bladder completely, if there are changes within the bladder itself. In many cases, we'll do a cystoscopy, which is a 2-minute painless in-office procedure where we look inside the bladder itself to see if there are any changes of chronic incomplete bladder emptying. We can estimate the size of the prostate and determine how obstructive it is, and then we go from there. But there's always a solution. In fact, there are many medications that can give you back your quality of life, allow you to only wake up once in the night to urinate, allow you to have that good stream of urine, to make sure that you can go 3 or 4 hours without having to worry about where the next bathroom is.
Right. You know, and obviously, I imagine people want to know even more about the next part of this conversation, which is, you know, how can you help to prevent prostate cancer?
So unfortunately, we have all the risk factors in our society for not just a high level of prostate cancer and in terms of high incidence. So prostate cancer is the #1 cancer in this country, far exceeding the numbers of breast cancer. So when we look at the population as a whole, what is the #1 cancer? It's prostate cancer. At least 100 men, unfortunately, succumb to prostate cancer every year, which is a tragedy of epic proportions, because prostate cancer is one of the easiest cancers to pick up when it's at an early stage, when it's organ confined, and it's one of the easiest cancers to treat. You don't even necessarily need surgery to treat prostate cancer. In fact, there are many minimally invasive or outpatient procedures that we can cure your prostate cancer on a weekend. You could be back to work with minimal or no recovery on a Monday. So this whole notion that prostate cancer is a death sentence is actually the opposite of the truth. It's the easiest cancer to treat. In fact, we can pick up prostate cancer so early that we can actively surveil you, because the prostate cancer that we've picked up is clinically of no significance to you. We can actively surveil you in many cases 6, 8, 10, 12 years before we need to cure you. So prostate cancer is not a death sentence. You need to have surveillance of prostate cancer because of the risk factors such as advancing age. That's the #1 risk factor for prostate cancer. African ancestry, unfortunately, is one of the greatest risk factors for prostate cancer. We have the 14th highest incidence of prostate cancer in the world. Obesity in itself, and we have an overwhelming number of men who are obese, that in itself will put you at greater risk for having a more aggressive form of prostate cancer as well. But we're, as Bahamian men, as Bahamian residents, we're our own worst enemy, because we don't seek annual prostate cancer screening, which only requires a prostate-specific antigen blood test every year starting at the age of 40. There's some people that they're genetically predisposed. Those people, we got to start screening at the age of 35. And we need to be very diligent in picking up prostate cancer early. For some men, unfortunately, because of genetic reasons, it's almost inevitable they're going to get prostate cancer. So we need to be on top of them, pick up prostate cancer early, and then we can offer them as many as 6 or 7 different treatment modalities that can give them an excellent cure rate. So getting prostate cancer could be a little bump in the road where we can cure you, in many cases, in an hour procedure as an outpatient, minimally invasively, and get you back on track as if nothing happened. Too many men in this country we're diagnosing too late, when we can do the opposite. We can diagnose them when it's clinically insignificant, and we can just monitor you and treat you when that prostate cancer becomes of some clinical significance.
Right. Wow, this has been an awesome amount of information that we've gone through today. Thank you, Dr. Pinto, for joining the show. We've covered so many topics that are near and dear to the hearts of men. So I want to thank you for joining You and Your Money today.
It's always my pleasure to be here. Knowledge is key. Never avoid your annual physical examinations for many reasons. If you have erectile dysfunction, please don't suffer in silence. There's always something that you can do to rise again, no matter what the circumstances, no matter how long you've been on the sideline and your erections have been failing you. Male infertility, please don't let that be a depressing issue. You can always have a child, no matter what, because of the advances of reproductive technology. And if you have any urinary issues, if you're having the bladder control your life, we can always get you back on track. Prostate cancer screening is imperative in this society because we have all the risk factors. Please get your annual PSA blood test every single year.
Thanks again, Dr. Pinto. A critical component of our conversation today was the need for regular checkups and screenings. Doctors Hospital offers annual visits and checkups at multiple locations, including Centerville Medical Center and our Micro Center at Carmichael Road. Interested individuals can book appointments online for either location by visiting www.doctorshosp.com or by calling CMC at 302-3250 or Carmichael at 302-3270. It has been a pleasure hosting today's show. Don't forget to follow You and Your Money on social media and tune in next week for another exciting show. Thanks for watching.
And that concludes tonight's episode of You and Your Money. Tune in next week for another great show.